staging of breast cancer is done right after the diagnosis. It's critical to determine whether you're stage 0, 1, 2, 3, or 4. 4 is the highest, and that's when you have metastatic breast cancer. It's terminal. It's manageable and treatable, but it's not curable. So eventually you will die from it. But in stages 0 through 3, there are various treatment modalities that can pretty much get your cancer under control and free you of any active cancer cells in your body. And it depends then on the stage. For example, if you have a relatively large tumor and it affects the lymph nodes, and maybe they've diagnosed you as being at stage 3, there's also breakouts of those. There's 3A, there's 3B. The treatment they're going to prescribe for you is going to be more involved than treatment for a stage 0. In fact, there are some oncologists who don't feel a stage 0, especially if it's DCIS or ductal carcinoma, should even be treated. Personally, I would have it treated because some of those do go on to become more complex and involved. So in one stage, you might have chemo, radiation, and surgery, move the lump, have a couple rounds of chemo, have some radiation to the site, and you're done. In others, it could be longer term. It could go on for months or years. Surgery and radiation may or may not be warranted. In my case, because I have stage 4, I had lobular on the left and I had ductal on the right, and I was totally blown away that I could have 2 different kinds of tumors. But if a tumor is growing long enough, it will jump to the other breast. And where it lands, does it land in the lobes or does it land in the ducts is the kind of tumor it's going to form. So in my case, as they told me, the horse is already out of the barn. There's no sense in doing a mastectomy or bilateral. There's no sense in even doing radiation. My treatment of choice was chemo. And it was successful. It put me in remission after 2 different combinations of drugs over a period of 7 months. And I have been in remission for 6.5 years. So right now that's a success story because they tell you the average lifespan is 3 to 5 years. But don't listen to those numbers. The numbers are changing radically. Don't think you have a death sentence. And because women are living longer and the treatments are getting better, they have targeted treatment, they have immunotherapy, which actually causes the body to fight the cancer itself, because your immune system is attacked when you have cancer and it needs some help. So those have been, they've been in a lot of clinical trials with the immunotherapy, and they're proving to be rather successful. And in fact, with leukemia, they've eradicated it in a lot of kids. So we need to do more work in breast cancer, but there are things that can be done at each stage. Let me also sidestep a minute with the radiation. There's called an approach to treatment called adjuvant, where they do the radiation after they take the lump out and after they do the chemo. And the purpose of that radiation is to kill off any cells that might be left that they didn't get. And then there's neoadjuvant that is done for the larger tumors, where the radiation comes after the chemo, because you're shrinking the tumor with the chemo, and you're able to more successfully excise that tumor or treat it when it's not as large and you don't have as much of a tumor burden. So there's quite a at one time, if we go back, in fact, only a decade, it was almost one size fits all. Everybody got the same chemo drugs and everybody got the same treatment. Now it's really very specific. Once they test you and find out what kind of tumors you have, do you have estrogen, progesterone sensitive tumors? Are they positive, negative? There's triple negative cancer. There's triple positive. There's so many different kinds. They're learning all these different kinds, and each different kind requires a different type of treatment. So it's really important that you get really good diagnosis. I recommend to people that they go to comprehensive cancer centers because they follow the latest protocols. And a protocol would have, it's almost like following a recipe. They'll have a specific form of treatment for stage 0, stage 1, stage 2, stage 3, stage 4. And then if this doesn't work, you go on to this. If that doesn't work, you go on to this. So, you know, it's a very scientific approach to treating breast cancer.